For me, fertility preservation is very much a part of reproductive choice. And the problem is that reproductive choice in our country is still not as high on the priority list as it should be. I still feel that awareness on the side of the patients, on the relatives, regarding fertility as an important aspect of life, and the fact that they have control over that fertility needs to be emphasized much more than what we are currently doing. As far as what happens after a patient has decided, in this instance, to undergo fertility preservation, again, this is a fairly nuanced topic, which is perhaps not realized. For example, you have a newly married girl at, say, around 25 or 26. She's had a diagnosis of cancer. Now she's come to you for fertility preservation. One of the nuances that you need to talk to her is whether you are going to freeze her oocytes, that means her eggs, or whether you're going to freeze her embryos. This actually speaks to reproductive autonomy. Cancer is going to affect her life in a very significant way. Don't you want to give this woman a choice? Say, for example, her marriage runs into trouble because of whatever reasons, either cancer or any other kind of reason. Don't you want her to have the reproductive autonomy to choose the gametes of the partner whom she will engage with later on? So, although it is a sort of a knee-jerk reaction to say that, oh, she's married, let's make egg, let's put the egg and embryo together and freeze the embryos. I think we need to pause and think over here about her reproductive autonomy. And rather than talking about freezing embryos, start talking about freezing her eggs. And that makes sure that she has the reproductive autonomy to choose her partner in the future in case downstream something goes wrong with her marriage. The other options, of course, are there. There is embryo cryopreservation, where we make the lady grow her eggs. And I must again emphasize that this is not necessarily a very lengthy process. This can take place in 10 to 15 days. And the woman can actually start undergoing treatment for her cancer within 10 to 15 days of having her eggs retrieved. You can either freeze her oocytes, that's her eggs, or you can freeze her embryos. You have to speak to her and decide what to do. Personally, particularly at a younger age, I would always prefer to freeze eggs rather than embryos, because for me, it's a matter of reproductive autonomy. And of course, there are other options like oocyte tissue cryopreservation, etc. But I would have to say that in routine clinical practice, most of the times what happens is when a woman comes to us for fertility preservation, we stimulate her eggs, we remove the eggs from her body using a transvaginal ultrasound, that means a sonography that is done from below. And then we freeze either her eggs or embryos. And if it's a male who comes to us, then we try to collect a few semen samples. And if there is no time to collect 2 or 3 samples also, it is relatively easy to remove the tissue from the testes of the male and then cryopreserve that. The results of that are also very, very good. So these are essentially the 2 options that patients have when they make a diagnosis of cancer and then they come to us for fertility preservation.